Good afternoon, everybody. Welcome to the Baltimore City Health Department COVID-19 Town Hall for the month of April. Thank you all so much for joining us today. I am very excited since we were able to host a town hall. And I'm particularly excited because today's town hall features some internal superstars at the Baltimore City Health Department. Last week was actually National Public Health Week, and the focus was public health is where you are. And I know I feel fortunate, I feel blessed to be in Baltimore City and have a really amazing team at the Baltimore City Health Department that make my job a lot easier. So I'm excited that we get to have them talking about the work and talking about important updates around COVID 19 today. So, with that, we will start with a brief agenda. So, I'll be introducing today's panelists, Dr. Darcy Phelan Emmerich and Dr. McDowell. Dr. Phelan Emmerich will be providing data updates. I'll spend some time reviewing the COVID community level indicators, which were released just last month by the CDC. Dr. McDowell will talk about general booster recommendations for the population, as well as our pediatric vaccination strategy. And we'll close out the session, our formal presentation anyway, talking about COVID 19 oral therapeutics or oral medications. And then at the very end, I'm hoping that we'll have plenty of time for questions. Again, thank you guys so much for joining us. So it is my pleasure to start with introductions of today's panelists, starting with Dr. Darcy Phelan Emmerich. Dr. Phelan Emmerich is the chief epidemiologist at the Baltimore City Health Department. She has been with the department since 2015, and she holds a joint appointment at Johns Hopkins Bloomberg School of Public Health. I've known Darcy even before my time at the health department, and I've always been impressed by her desire to let data guide our decisions, her work ethic, and her commitment to analyzing and validating the data so that we at a leadership level have the best information possible so we can help make the best decisions. After Dr. Phelan Emmerich presents our data updates, we'll be joined by Dr. McDowell. Actually, I'll present and then Dr. McDowell will present. Dr. McDowell is the Baltimore City Health Department Chief Medical Officer. She has been with us since October 2020. So she joined us right early on and was thrust very quickly into the role of a clinical leader here at the health department at the beginning of the pandemic, right before vaccinations and our vaccination efforts went live. Dr. McDowell has been fundamental in helping to lead our vaccination efforts and ensuring that we are always pursuing the work using an equity lens. Dr. McDowell is a pediatrician by training. She actually trained at the University of Maryland Medical System. She also has a master's in public health from Columbia, and again has spent much time in the public and private sector working for both the CDC as a fellow, as well as for a federally qualified health center in DC. She, like me, is a pediatrician by training, and we're so excited that she's able to join us today. With that, I will turn it over to Dr. Phelan Emmerich for our data updates.
Thank you so much, Dr. D. Good afternoon, everybody, and thank you for joining us here in this town hall. I'm excited to present data updates to you regarding COVID, and we're going to do that by taking a look at our city's COVID dashboard. So you should be able to see my screen, if not now, in just a moment. And what I'd like to do is give you an overall data update on the burden of COVID in Baltimore City right now, and then point out some new features of the dashboard that we launched a couple weeks ago that we're excited about. So this is our data dashboard. It's available at coronavirus.baltimorecity.gov, and it has a bunch of information that's helpful for understanding the burden of COVID disease in Baltimore City. On the left-hand side here, we have information about cases. So this is COVID cases among Baltimore City residents. And the graph here at the bottom lets us look at the number of new COVID cases by day in Baltimore City. And this is since the start of the pandemic. So going all the way back to March of 2020, we have our first wave of COVID in the city, our second wave, third wave, fourth wave, And I sort of think about all of this as one big wave here, our fifth wave, and the large number of cases you see here were experienced in late December, early January. That was the Omicron surge that we heard so much about in the news. You might notice that there are some negative numbers in this graph and wondering about that. The reason we have a couple negative numbers is due to case corrections by the Maryland Department of Health. So these data are provided publicly by the Maryland Department of Health, and sometimes they make corrections in the data that lead to negative numbers. You might also be wondering too, the spike that you see here, this also is a correction in the data. There actually wasn't a spike in illness on February 20th. This just has to do with another data correction. So having done an orientation of our graph here, what I did want to point out is, of course, we saw a really large decrease in COVID cases from the Omicron surge, but we are starting to see a small uptick in terms of our daily number of cases. And this is something that we're keeping an eye on. So we had this lovely decrease from the Omicron surge and lower levels sustained for a bit of time, but we are seeing a bit of an increase in our daily cases. So just wanted to point that out. The next part of our dashboard features information about Cova Deaths. It expresses this information in terms of rates, as well as their cumulative number of deaths, which is about 1,700 in Baltimore City. Similarly, there is a graph for the number of deaths by date. You might be asking yourself, what is going on with this huge spike in the data? Again, this was a data correction done by the Maryland Department of Health. When they made this data correction, they actually did a press release about it because they knew it would affect the graphs for all of Maryland's jurisdictions. There were not 91 deaths on a given day. This was just when the data were reported. You might also notice too, we have a bit of a space here, a gap in the data in December of 2021 to early January of 2022. And this has to do with a cybersecurity incident that occurred at the Maryland Department of Health. They had a data outage due to their cybersecurity incident. So these data are missing for this time period. What I wanted to point out in terms of our overall trends is that you can see the waves again that we saw with our cases, this being the first wave, second wave, third wave, fourth wave, and then the fifth wave here associated with Omicron. And you can see that we did have our highest number of deaths on a given day during the Omicron surge, and that our daily death numbers have really come down, have been greatly reduced. I also wanted to point out too here on the dashboard that we have a percent change calculation that shows, for instance, the number of cases, how much larger or smaller are they in terms of a percent from 4 weeks earlier. So for cases, we have an 11% increase, which means over the last 4 weeks, we've seen an 11% increase in our daily number of cases. You'll notice here for the deaths that it says, it's starting to say infinity. This is because we've had so few deaths recently. These numbers are quite small that they can lead to large differences and changes in the percent change estimate here. So this is something we're working on further explaining why this says infinity here, but it has to do with such small numbers that we're seeing in terms of our daily deaths. The next panel we have here is on hospitalizations. Presently, there are about 57 people hospitalized in Baltimore City for COVID. This represents about a 29% decrease from 4 weeks earlier. And the graph here we have are the number of COVID hospitalizations in Baltimore City hospitals by date. And again, the waves that we talked about for both cases and deaths, wave 1, 2, 3, 4, and 5. Here with our Omicron surge, we had up to 900, over 900 people hospitalized at a given time in city hospitals with COVID during the Omicron surge. And those numbers have greatly reduced, and we are now down around 60 at about 57 or 60. Other information on our main dashboard here, percent of the population that's vaccinated, ages 12 and above with a first or single dose. We're at about 82%. And we also have something new here called the CDC COVID community level. And the Commissioner of Health, Dr. D, is going to talk with us just in a few moments about the COVID community level and what it represents. This is updated on a weekly basis. The new data come out late on Thursdays, so this will be updated tomorrow. But right now our COVID community level is low, and we have about 56 new COVID cases per 100,000 people in the past 7 days. 1.6% of our staffed hospital inpatient beds are occupied by COVID patients, and we have about 3.4 new COVID hospital admissions per 100,000 people in the past 7 days in the city. And again, Dr. D will be talking about this in just a moment. I wanted to just highlight a couple new features of our dashboard. We are using new data sources here for our cases and our deaths, as well as for our vaccines. We have switched to what's referred to as open data or publicly available data. When the cybersecurity incident occurred with the Maryland Department of Health in December, we had a big pause on our data and we weren't able to update the dashboard for some months. And by switching to open data, that's given us an opportunity to go back to continuing to update the dashboard on a daily basis. We also switched to open data in terms of some of our testing information as well. I wanted to highlight on our testing page our 7-day average for test positivity. So this basically means among the people who take a test on a given day, what percent test positive. And most recently, we're at about 1.9% testing positive. This is a slight increase over, we saw a big decrease after the Omicron surge. We are creeping up ever so little bit, so keeping an eye on that. And then the graph here at the bottom represents our overall test count. So among Baltimore City residents, how many people are tested on a given day. The gap in the data here has to do with the gap of the pause in data from the Maryland Department of Health associated with their cybersecurity incident. Right now, there are about 4,300 tests happening among Baltimore City residents per day, and that is about a 61% increase over the last 4 weeks. And so with that, I'll show you one last thing on the dashboard, which is our Key Metrics tab. And our Key Metrics tab has been updated to include our new data sources that I mentioned, those open data sources for new cases, deaths, test positivity, and our percent vaccinated. So just wanted to give you this overview of our dashboard. So we've talked about that we're seeing a slight increase in COVID cases, a slight increase in test positivity, but still very low levels of hospitalizations and low levels in the number of deaths. And then we've also just taken a quick peek at some of the new things on our dashboard. And so with that, I'd like to turn it over now to Dr. D so she can tell us about our new COVID community levels indicator. Thank you so much.
Thank you so much, Dr. Phelan Emmerich. So as mentioned, I will be talking now about our COVID community level indicators. And these are relatively new. They were just released by the CDC last month. And they're a new way of evaluating the risk level within a community level. So if you remember, previously we were looking at something called community transmission levels, and this was on our dashboard. This was found on the CDC COVID-19 data tracker, and it looked at the rate of new COVID-19 cases per 100,000 people in population and positivity. So those were the primary two factors that were used in determining whether a particular jurisdiction, whether it was a city or a county, was in the low or actually the low, moderate, substantial, or high transmission rates. So those were the four categories that were previously being looked at. So in March, the CDC actually released updated guidelines that focus on what's called community level indicators. And it looks at COVID hospital admission rates. So hospital admissions that are attributable or associated with the patient that has COVID, the percentage of staffed hospital beds, and it's actually all beds, not just ICU beds, but the percentage of hospital beds used by COVID 19 patients, and the rate of new COVID 19 cases. So, still considering the new cases being identified through testing. But as you can see, positivity is no longer included as we think about community level indicators. And the CDC has put out a lot of information. They did a lot of retrospective analysis to come up with these measures. And I think part of their reasoning was that we know that with a lot more at home, many people are testing, whether it's positive or negative, at home, and those rapid tests aren't necessarily entered into the broader kind of testing results ecosystem that we in public health look at. And so, are we really accurately capturing those that might be at home with mild disease that test positive, or those again that are testing but are negative? And so that is part of I think where this shift has come from. So, with this new change, the CDC has provided some preventive measure recommendations based on if a jurisdiction or community is within the low, medium, or high risk level. Next slide. So this is taken directly from the CDC website. And so again, using those data points, you can be categorized as a city or jurisdiction as either low, medium, or high. And in the low range, it's recommended that everyone be up to date on vaccinations. That's inclusive of boosters. And if you're experiencing symptoms, that you get tested and you follow appropriate isolation and quarantine guidance pending the results of that test. In the medium range, so again, being dictated by case rates, hospitalizations, and staffed hospital beds for COVID 19 patients, if you are a person who's considered to be at high risk for severe illness, so this is a person maybe who is immunocompromised or has diabetes or has chronic lung disease, if you are in that category, of course you should talk with your healthcare provider, but it would make sense to wear a mask in higher risk settings such as indoor places. Additionally, again, everyone should be up to date on their vaccinations, including boosters. Anyone experiencing symptoms should get tested and isolate and quarantine appropriately. And then there's that last category, the high category. So again, if we're seeing significant increases in hospitalizations and new cases in ICU bed, or I'm sorry, hospital beds, all hospital bed staff with COVID patients, then we would be considered to be in the high category with the recommendations for everyone to wear a mask when indoors, regardless of vaccination status, everyone to be up to date on their immunizations, everyone to get tested if they're experiencing symptoms, and again, for that higher risk populations, there may be some additional measures in discussing with your healthcare provider that make sense. I do want to stress that regardless of where we are, it's okay for anyone to wear a mask at any time. If that is a part of your comfort level, then by all means, wear a mask when you're indoors. We know that masks are still required on public transportation. The CDC just extended the requirement for masks on federal public transportation. So we know that that is still the case in some instances. We know that there are some businesses that still require masking, as some businesses also require vaccination. Again, I would especially say to individuals that are high risk, so those that are immunocompromised, those who have diabetes, chronic lung disease, asthma, that you should always be in concert and connection with your healthcare provider to discuss your own personal risk, and certainly take additional precautions as needed. So, as Dr. Phelan Emmerich mentioned earlier, currently we are indicated in Baltimore City to be in the low community level. So, based on our hospitalizations, based on our current case rates, we are considered low. And this data, again, will be updated tomorrow. All right, with that, it is my pleasure to turn it over to Dr. McDowell to talk about booster recommendations.
Hi, everyone. Thank you for joining today's town hall. I'm going to discuss booster recommendations. There have been some updates on who can receive a booster as of about 2 weeks ago. Next slide. Great. So what we know is that boosters do work to enhance our body's immune response and protection against COVID-19 disease and the SARS-CoV-2 virus. Currently, the recommendation is anyone who is 12 and older can get a messenger RNA booster. So a Pfizer booster, if you're 12 and older, if you're 18 and older, you can get the Moderna booster after completion of your primary series, so those first 2 doses. Recently, based on data from Israel and other countries, the CDC and FDA have determined that certain populations are eligible for a second mRNA or messenger RNA booster. So anyone who is 50 years and older is eligible to receive a second booster or a 4th dose. So you would have received your 2 doses of the Pfizer or Moderna vaccine, and then you would have received your 3rd dose, which is the booster. If you are 50 and older, you can now receive a 4th dose or your second booster as early as 4 months after you received the last booster. Those children that are 12 and older who are moderately or severely immunocompromised can also now receive a booster as well. So again, the recommendation is if you're 50 and older, get that second booster. If you are 12 and older and you have a condition that makes you moderately to severely immunocompromised, also get the second booster. Unfortunately, children that are younger than 12 are not eligible for a booster as of yet. However, children that are 5 through 11 years of age and are moderately to severely immunocompromised can need to receive 3 doses, so 3 primary series doses. So that kind of is the big change. Individuals that are 18 years and older who are moderately severely immunocompromised and received 1 dose of the Johnson & Johnson vaccine can get a second dose of either the messenger RNA vaccine, so the Pfizer or Moderna vaccine, plus booster doses as well. Right now, we really are recommending that individuals receive the Pfizer or Moderna vaccines if you're deciding to get your first dose, your second dose, your 3rd dose, or your 4th dose as the booster. You can mix and match. So let's say for myself, I was initially vaccinated with Moderna for my 1st and 2nd doses. When I got my booster, I could have been vaccinated with the Pfizer or the Moderna vaccine. Next slide. So now I want to transition to our pediatric vaccination strategy. As mentioned, children that are 5 and up can receive the COVID-19 vaccine, and those that are 12 and up can actually get those that are 12 and up and moderately to severely immunocompromised can get the booster. However, children that are less than 4, under 5 years old at this time, clinical trials are being conducted on the effectiveness and also the safety of the vaccine in this age group. And so they are not available as of yet, but we do anticipate that Pfizer and Moderna will be submitting their data to the FDA for a comprehensive review. We currently, as a city, have a goal to vaccinate 80% of our 5 to 11-year-olds. with the COVID-19 vaccine by September 30th, 2022. And once the vaccine becomes available for infants and children, we are looking to be able to vaccinate those children 80% by June of 2023. We know that parents, caregivers, grandparents are going to have questions about the vaccine. I'm a pediatrician myself, so there are going to be questions about vaccinations, which are completely appropriate. In our job as a city, as a health department, as medical providers, as public health, is to really provide answers to those questions around the vaccine in our child population. So we are focusing on reducing vaccine hesitancy through trusted community ties. We are working and building upon successful and existing networks, such as Be More for Healthy Babies. We're working to train city school faculty, childcare providers, and also parents about the vaccine so that they can get their questions answered and also answer the questions of their community members. We are looking to and are currently enhancing our existing youth advisory councils to support youth, parents, physicians, and also teacher ambassador programs. For vaccine distribution, we're focusing on making sure that the vaccine is available where parents and caregivers want their children to get vaccinated. And that's really the primary healthcare system. So we're working with our pediatrician providers, our obstetric providers, and our family practice providers, getting them information about the vaccine itself, how to get access to the vaccine, and also support around the vaccine peer ambassadors. We are currently holding community-based clinics in our low vaccination coverage areas at Judy centers, schools, and libraries, and have been working with the school system for months now, and also the library and those Judy centers, again, creating a trusted place where parents feel comfortable bringing their children and family to get vaccinated. Next slide. Lastly, I want to talk about COVID-19 oral medications. So currently there are medications that are available to decrease an individual's chances of progression to severe COVID-19 disease. Treatments are widely available in the United States and also Baltimore City. Treatment, again, for COVID-19 is available to some people who are high risk for developing severe disease. These treatments reduce symptoms and also chances of being hospitalized. Anyone who is 12 and older and has tested positive for COVID-19 and has symptoms may be eligible for treatment. I do want to stress that it is very important to seek treatment if you are 65 and older and you are positive for COVID-19, or you have an underlying medical condition that increases your risk of severe COVID-19. That can include pregnancy, diabetes, hypertension, heart disease, cancer, immunodeficiency, and other underlying medical conditions. If you get tested and your test is positive, very important, contact your primary care clinician to let them know that you tested positive and that you are interested in getting treatment for COVID-19. Next slide. So just to go over briefly what treatments are available. So there are two types of treatments. There are oral medications, which you can take as a pill. And then there are injections, which you have to go to a clinic or an infusion site to get the medication. The oral antiviral medications need to be prescribed by a clinician, and they are available at local pharmacies and also through the federal government's Test to Treat program. Paxlovid, which you may have heard about in the news, is highly effective. So if you start this medication within 5 days of symptoms starting, then it reduces your chances of hospitalization and death by 88%. Molnupiravir is also available. It reduces the risk of hospitalization and death by 30%. And that medication is used for individuals that, for some reason, cannot tolerate Paxlovid. The other medication is this monoclonal antibody injections, which have been around for a while. It also requires a clinician to prescribe this information and is done at a clinic or an infusion site. Evusheld is a particular medication for those, it can be given to those that are moderate to severely immunocompromised before they have been infected or exposed to the virus that causes COVID-19, or for individuals that for certain reasons cannot get vaccinated. This injection will protect you up to 6 months. So if someone, again, is moderately to severely immunocompromised, truly recommend that you speak with your provider about these medication options, such as Evusheld. The other medication is a monoclonal antibody injection, so it has to be an infusion, and it's called bebtelovimab, and that one can be taken within 7 days of the start of symptoms. Currently, the most widely available medication out of these, all of them are widely available, but Paxlovid, again, being an oral medication, easy to take. It's 3 pills that you take, and you need to take it within that 5 days. Lastly, I do want to note that vaccination is still the first line of defense. These medications are really for those that are high risk of, because they have an underlying medical condition of progression to severe disease and hospitalization. So it's really that Swiss cheese model where we're layering on top measures that we can take to protect individuals from having severe outcomes from COVID-19 and death from COVID-19. The vaccination is the best one, and then also these oral antiviral medications. Great. The next slide. So where to get treatment in Baltimore City? And I know we can drop this information, will be dropped in the chat box as well. So first off, talk to your primary care clinician. They know you the best. They know your medical history. If you do not have a primary care clinician, you can call the Baltimore City Health Department, and we can refer you to one of the numerous federally qualified health centers that have excellent service and clinical care. But talk to your primary care clinician, ask them about COVID-19 treatment. There's also the federal government's Test to Treat locations. These are locations where individuals can come and get tested, and if they're tested on the spot and they're eligible for the medication, can get a prescription for Paxlovid or Molnupiravir. In Baltimore City, there are all of the express cares in Baltimore City and also outside of Baltimore City are part of this program. You can either walk in because they're urgent cares, or you can call to make an appointment or go online to make an appointment. So we will drop that link in the chat box. CVS Minute Clinics. So only the Minute Clinics, and there are 3 in Baltimore City. But the Minute Clinics also have the Test to Treat locations. At most of the Minute Clinics, there might be a kiosk out front that will ask you if you're interested in the Test to Treat location, or you can schedule an appointment at the Minute Clinic to get testing and or treatment. You can visit the website. The federal government has a website, which we will drop in the chat box, to find a location where you can get medication for COVID-19 in Baltimore City. You can also call 1-800-232-0233. There is a disability information and access line for individuals that need access to disability services. And those individuals can call 1-888-677-1199. or email USAgingandDisability.org. These are both federal government resources. And that is all I have. I know hopefully there's some questions about this a little later, and I'll hand it off to Dr. Jaraza.
Great. Thank you, Dr. McDowell. We don't have a formal slide about BA2, but I did want to briefly talk about this latest Omicron subvariant because it is now the dominant variant here in the US, representing almost 86% of all the total samples that are being evaluated. So if you recall, BA1, which is what we associate with the Omicron surge that we saw in December 2021 and January 2022, this is a subvariant of that BA1. So BA2 is a subvariant of the larger Omicron that caused that initial surge. There are some genetic changes, specifically in the spike protein, that make it slightly different from BA1. Again, it is currently the dominant strain, and it is likely why we're seeing some of the case increases that we're seeing. So what we do know is that it is slightly more contagious than BA1, but it does not necessarily cause more severe disease. And it is believed that if you had BA1 or Omicron during that surge period, it confers some level of additional protection against BA2 subvariant. As Dr. McDowell mentioned, I think as we all stress, vaccines still remain highly effective against the BA2 variant. And I strongly recommend all individuals 5 and up that are eligible complete the vaccination series and follow up appropriately with your boosters. Again, we know that the public health mitigation measures work, and we see vaccination as one of our primary defenses as we move forward through the pandemic. With that, we did want to leave some time for questions. And so I see that we do have one question so far from Mr. Butler. Any thought on requiring people to submit at-home rapid test results? Not sure if this is even possible. That's a great question. And so there are mechanisms by which individuals can call the state health department and indicate that they have had a positive rapid at-home test. It is not mandatory. It is not required at this time, but certainly it's encouraged if possible. I think at the same time, for those that are testing at home, maybe just a quick reminder that even if you yourself are experiencing just mild symptoms, or maybe you tested and you're not having any symptoms at all, it's still critical that you follow the CDC guidance around isolation and quarantine so that you don't unknowingly expose someone who might be vulnerable to severe disease. So again, always going to recommend that you're up to date on your vaccinations. That's one of the most protective things that you can do. But if you do by chance test positive, even if you're having mild symptoms or no symptoms at all, please continue to heed that isolation and quarantine guidance. Please notify your close contacts prepared and isolate or quarantine appropriately and test and follow up appropriately as well, so that we're, again, not unknowingly transmitting disease to those that may have a weakened immune system or may, again, be at risk for severe COVID-19 disease and hospitalization. All right. Well, we don't have any more live questions, but I do want to bring back Dr. McDowell and Dr. Phelan Emmerich to see if they have any thoughts as we're waiting for questions to pop in, or things that they think that the public should know about COVID-19.
Yeah, so I will jump in and talk about, I really want to, because we're on pediatric vaccines right now, and they are becoming available. And what we do know about pediatric COVID-19 is that there are children that are getting COVID-19, that are getting infected, and unfortunately children that are also passing away from COVID-19 as well. When we do look at the data, we see that of those children that have passed away from COVID-19, the majority have been African American, Hispanic, Latinx communities. So this really is, I think, a call to our community. I know myself as a pediatrician, as an aunt as well, that our children need to be vaccinated. The vaccine is going to help protect our children against death from COVID-19, of course, hospitalization from COVID-19, but also kind of some of these unknown long-term effects. So there is emerging data that the vaccine might have some protection against long-term COVID or a long hauler COVID. So these are reasons why the vaccine is so important for everyone to take, but in addition for our children to take as well.
Great. Thank you for that, Dr. McDowell. As you were talking, we have another question that rolled in, and it's, is there discussion of rethinking mask mandates with BA2 subvariant and increasing caseloads? So that's a great question. And I will say we are constantly evaluating the data to determine if and when additional restrictions should be implemented. Recently we spent some time today talking about the CDC COVID community levels and those indicators and how those provide guidance. And we're really looking at those, right? And that really focuses on, yes, cases, but also hospitalizations as we think about whether or not to implement masking restrictions. And so we'll continue to follow the data. Again, I think nothing is ever off the table, but we also want to be, mindful of this new data and these new recommendations that have been released by the CDC around masking once you hit certain criteria, specifically around hospitalizations, the percentage of staffed hospital beds with COVID-19 patients, and case rates. We don't have any more active questions. I do want to thank everyone so much for attending. If we get questions in the next few moments, we'll certainly try to answer them. But again, really appreciate everyone for attending today. Want to thank my guests today, Dr. Phelan Emmerich and Dr. McDowell, for their presentations. I hope the information today was helpful. And I would ask that everyone continue to stay safe, and please get vaccinated and get boosted.